Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Right, we have now Dr. Gary and he's gonna work on Sherwin. He just had ASTR class training and we'll see how he's gonna do his evaluation and treatment. So go ahead.
Okay, start with where your pain is. Can you show me? And open. Okay.
So let's get a brief history. How long this been going on? How, like, what's going on? So you have 2 years of trigger finger.
Did you have an injury or?
I cannot think of any.
Okay.
Working in the nursing home, lifting, but last year, so I cannot think of any incident where I injured it maybe from work, but.
So this has been going on for 2 years. What kind of treatment you had for in the last 2 years?
So that I can get rid of it with exercise and change a little diet, but still
You still have it. Did you had like physical therapies, massage, anything? Okay, so
do my own self-treatment.
you are a physical therapist, yeah? So you've been doing your treatment, like massage it and you did exercises on it, but you still have it, okay?
It's getting better, but it's still there when I wake up. You know, I notice when I eat more meat.
How much pain now from 0 to 10?
It's about 3.
3. At worst, how much pain?
In the morning, it's still about 7 or 8.
Okay, let's aggravate it now and get the symptoms before. And let me see it in the camera here. Hands up. Okay, and open it. You definitely can see the trigger finger, like it's stuck. Okay, so we're gonna do the treatment. Dr. Gary gonna work on your finger, and then we'll test it again.
Okay. Open it up. Where's the pain right now? In this joint? Okay. Can it open up?
To open it up, I go like this and snap. You see that?
Okay. So you got some restriction on pain?
No pain.
So guys, you guys tell us about yourself while you're here. So Sherwin, how long have you been practicing?
Been here practicing in California about 15 years.
As a physical therapist?
Physical therapist.
Okay. So who do you work with? Outpatient?
I work in it's a skilled nursing facility.
Mm-hmm.
Well, mostly geriatrics population.
Mm-hmm.
Been in home health for the last 3 years.
Mm-hmm.
The one feels good, but a little tender.
Mm-hmm.
Yeah.
So Gary, where are you working? Tell us about yourself.
I've been a chiropractor for 14 years, and I do home health now.
Mm-hmm.
And I was a physical therapy assistant for 15 years before that.
Mm-hmm.
So I was the oldest guy in my chiropractic class.
Wow. So what? Mm-hmm.
Mostly focused on soft tissue work. Didn't do a whole lot of adjusting.
Mm-hmm. So what do you think about ASTR class? You had 3 days of class. So do you feel you're ready to work on patient?
Pretty much, yes.
Mm-hmm.
Yes. It seems to be a lot more efficient.
Mm-hmm.
You feel that loosen up?
Yeah.
It's
It's loosening
it's
up.
moving so much better.
That really feels good. I feel like,
All right.
yeah, with the
Let us know if you feel any pain, okay? Just don't scream in the camera.
So that one is really restricted.
section, you can do it again. Where you can press the button again. Do it. But it's just
Yeah, you really have a bad case of trigger finger, by the way. This is
relief, you know,
severe. Hmm.
like I did when I was 12.
So let's use the instrument and we'll...
Okay. So, here. That doesn't move.
That's the moment.
Mhm. Feel you have more grip with the instrument, easier?
Yeah,
Some
there's
parts.
Bigger
Areas, yeah. Mhm.
area. Feel that different?
Mm-hmm. No motion.
And it's interesting to feel the different
Hmm.
areas have different directions of resistance.
That's correct, yep. Hmm. Is it easier to feel it with your hand or the instruments?
No, it's pretty easy with the instrument.
Make it easier for you. Hmm.
Easier than I thought it would be.
Hmm.
Less painful too. No pain in the hand.
Oh, less pain with my hand when I do it with my hand? Or
Less
with the-
effort. Less effort.
Oh, effort, yes.
Less effort with the instrument, you mean?
Yes.
Yep. Hmm. Yeah, and because if you use your hand repetitively with a lot of patients, might have arthritis from repetitive strain injury, overuse. So let's go for A3, A4. We'll get the whole thing.
Okay.
You guys feel free to switch different person just to get the feel of working on different body part.
So she,
Oh, this is
Did you see the trigger finger before? It was severe, like a stuck, like this.
Oh,
Yeah. For 2 years.
more painful for proximal,
Yeah. Okay.
but they're there. Okay. Oops, sorry.
You're doing good, Gary.
I will get the whole thing proximal, like the whole muscle tendons.
Forearm.
Yep, just get the whole muscle. You'll do it. Really dig in.
oh, you want me to do the whole
And you also can use the A4, the A3.
Even the bigger one?
Mm-hmm.
No, just around this like my tendon.
Okay. Pressure okay?
Can you feel the scar tissue? I can see it here.
Yeah, right
Do you guys
there.
see it? With the instrument, it's just uneven.
It jumps like
It jumps.
Right.
Yep, you can see that exactly. And so you want to... I'll put more lotion.
all the way around, okay? Do you want me to do this side too?
Oh yeah, this is where the thing is.
Do you want me to do this side as well?
Is it your middle finger?
Yeah,
No, ring. Ring. Sometimes.
and it's really bad. He was like just stuck, like nothing moving when he make a fist.
Occasionally the middle, but mostly ring.
Mhm.
Surgery?
No surgery.
So I feel most of the
The scar tissue there.
resistance through here, right here,
Mhm.
right here.
Yeah.
Mm-hmm. Make sure you do the antagonist of that finger, right on the finger. So you can do the other one.
Now, would you do each section at a time, or
Oh,
you want to go?
just clean the whole house
whole thing?
quickly. Yeah, save time.
You okay with the pressure?
So what happened there? There's kind of scarred, like
This one
right
here?
there. What's
Oh,
going on?
Yeah, maybe I scratch it.
Mm-hmm. Okay, so that's good. Let's clean it up and we'll test his range of motion again. So you said your pain was how much at worst when we did the first today?
Oh, about 6.
Okay.
Wipe that up.
Okay, so let's clean that up and just have this in the, yeah, and get your hands up and, no, up, yeah, it's on your clothes so it will be, okay. All right, let's open it.
Assuming I'm gripping.
Mm-hmm.
Oh wow.
Oh my goodness. Yeah, it's in the video. Even he's scared.
How was it before?
It was
Is
stuck
there-
like
is there
this.
No resistance.
So you couldn't open it?
Maybe you could not open it.
Close open.
I will let you guys watch the video.
Miracle.
We have it in the
Wow.
video. Awesome.
Wow.
So Sherwin, any pain?
No pain.
So what do you think about ASTR treatment? Actually, what do you think actually working on him after
that was
3
so
days of
Easy.
That was so easy.
yeah, 3 days of training, just 3 days.
I thought you have to dig in more, but it's just you're doing just.
Yeah,
It was simple.
Wow.
yeah,
No
awesome.
pain. Zero pain. Full.
4 range of motion.
No
Can you go
resistance.
slower?
Okay, let me try again and squeeze. Because this is my problem with squeezing, opening jars. I cannot open it without pain. Ooh. No more.
Beautiful, awesome. So what do you guys think?
Great.
How many minutes? How many minutes?
Good job, Doc.
Yeah.
What was that?
Trigger
5
finger,
minutes?
5 minutes. Trigger finger, 5 minutes. No break. All right, awesome. You guys did a great job. Yeah, great job. Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.